we started this discussion by talking about how do you avoid the whole discussion about mandating vaccines. The way that you do that is you have a transparent process where people see that the vaccine is going to be tested. They see that it's tested fairly against a placebo, that it is, there's long-term tests that are going to be able to spot all of these difficulties, and that it's transparent and open. And yet, what we've seen from the current group of COVID vaccines is none of that's happening. They're skipping key parts of the test. A Moderna vaccine, which is the lead candidate, skipped the animal testing altogether. When they came to human testing, they tested it on 45 people. They had a high dose group of 15 people, a medium dose group of 15 people, and a low dose group of 15 people. In the low dose group, one of the people got so sick from the vaccine they had to be hospitalized. That's 6%. In the high dose group, 3 people got so sick they had to be hospitalized. That's 20%. Mm-hmm. They're going ahead and making 2 billion doses of that vaccine. And by the way, the people that they test them on, Alan, are not typical Americans. They use what they call exclusionary criteria. They are only giving these vaccines in these tests that they're doing to the healthiest people. If you look at their exclusionary criteria, you cannot be pregnant. You cannot be overweight. You must have never smoked a cigarette. You must have never vaped. You must have no respiratory problems in your family. You can't suffer asthma. You can't have diabetes. You can't have rheumatoid arthritis or any autoimmune disease. There has to be no history of seizure in your family. These are the people they're testing the vaccine on. But that's not who they're going to give them to. Mm-hmm. They're going to go, what happens? These people are like the Avengers. They're like Superman. You can shoot them with a bullet and they won't go down. What happens when they give them to the typical American, Sally Sixpack and Joe Bag of Donuts, who's 50 pounds overweight and has diabetes? What is going to happen then? You're not going to see 20%. You're going to see a lot of people dropping dead. These people lost consciousness. They had to go to the hospital. They had huge fevers. And they're the healthiest people in the world. So any other medicine, Alan, that had that kind of profile in its original phase 1 study would be DOA. The problem is Anthony Fauci put $500 million of our dollars into that vaccine. He owns half the patent. He has 5 guys who are working for him who are entitled to collect royalties from that. So you have a corrupt system, and now they've got a vaccine that is too big to fail. And instead of saying, hey, this was a terrible, terrible mistake, they're saying, we are going to order 2 billion doses of this. And you've got to understand, Alan, with these COVID vaccines, these companies are playing with house money. They're not spending anything on it, and they have no liability. So if they kill 20 people or 200 people, 2,000 people in their clinical trials, big deal. They have zero liability. And guess what? They've wasted their money because we're giving them the money to play with. Oh, people like me and people in our community are looking at this process, and we're saying, whatever comes out of that process, we don't want to take it, because we're seeing how the sausage gets made, and it's really sickening. No medical product in the world would be able to go forward with the profile that Moderna has.